Okay, let's dive right in. For generations, women's health has been treated like some big mystery, a niche subject full of symptoms that get brushed aside. But what if the problem isn't the female body at all? What if it's the way we've been taught to look at it? In this explainer, we're going to unpack exactly why it's been so misunderstood and what it means to start unlearning all of it. It's a question so many people are asking themselves because they're struggling. They're dealing with things like PCOS and endometriosis, or maybe just trying to figure out their own menstrual cycles. For way too long, women have been left with more questions than answers about their own bodies. And a lot of the time, they're just told their pain is normal or that it's all in their heads. And this number tells you so much of the story right here. Of the roughly $450 billion spent on medical research in the US, less than 1% is dedicated to women over 40. Think about that. We're 51% of the population, but when it comes to the research funding, we're basically an afterthought. Can you believe that? This was actually said by a senior physician to a medical intern about a 40-year-old woman who came in with a whole list of symptoms: weight gain, low libido, fatigue. And that dismissal, it wasn't just some rude off-the-cuff comment. No, it's a window into a systemic bias that has taught generations of doctors that a woman's unexplained suffering isn't a medical puzzle to be solved, but a personality flaw. So that brings us to our first section, a systemic blind spot. Because this isn't about one bad doctor, it's about a foundational blind spot in the entire field of medicine that has real, measurable consequences for millions. It's a system that, frankly, just wasn't designed to see women clearly. And this slide right here shows that blind spot in action. Look at this. For a condition like endometriosis, which affects 1 in 10 women, the average time from when symptoms first start to when someone gets an actual diagnosis is between 7 and 10 years. A whole decade of pain, of being dismissed, of being told it's just a bad period. Which brings us to section 2. Not just little men. And this really gets to the core of the problem. It's a simple but deeply, deeply flawed assumption that has shaped pretty much all of modern medicine. The idea that a woman is basically just a smaller version of a man. I mean, just look at this timeline. For centuries, since the very dawn of medicine, the male body was the default. That's it. Everything from drug dosages to disease symptoms was based on male physiology. In fact, it wasn't until 1993, that women were even required to be included in US clinical trials. We are playing a massive, massive game of catch-up. And this slide just brilliantly shows why that catch-up is so vital. We are fundamentally different, right down to our cells. Men tend to have more fast-twitch muscle fibers. Women have more endurance fibers. You know that classic widowmaker heart attack? That's more common in men. In women, it's often caused by a totally different kind of disease in the microvessels. Our cells literally behave differently in a petri dish. We are not little men. All right, so section 3, your cycle, a vital sign. So how do we start to fix this whole mess? Well, we can start by reframing something we've been taught to just ignore or even hate as the critical piece of health data it truly is, the menstrual cycle. It is so much more than just a thing that happens before pregnancy. The easiest way to think about it is like this. Your cycle is a monthly report card on your overall health. It's this whole hormonal symphony that plays out in 4 main parts. It kicks off with signals from your brain, then moves into an estrogen-dominant phase as an egg grows, it peaks at ovulation, and then it shifts into the progesterone-dominant phase. Each and every one of those stages gives you critical clues about your metabolic, immune, and hormonal health. And this is the crucial point. Your body is designed to have this process work like clockwork. If that symphony isn't playing on a predictable schedule, if your cycles are consistently all over the place, it's not just some inconvenience you have to deal with. No, it's one of the earliest and clear signals your body can send that something else, something deeper in the system, needs your attention. Okay, so let's move to section 4, decoding common conditions. Let's take this new way of looking at things, viewing the body in its cycles as one integrated system, and see how it helps us understand 2 notoriously misunderstood conditions, endometriosis and PCOS. This isn't just a statistic. This is the real story of a patient named Liv. For 17 years, she was in agonizing pain. She had multiple ER visits, was dismissed as having gastritis, and even had her appendix removed for no reason. Finally, at age 30, she was diagnosed with stage 4 endometriosis. That's a chronic inflammatory disease where tissue that's like the uterine lining grows outside the uterus. Her story is devastating, and it is devastatingly common. And for polycystic ovarian syndrome, or PCOS, the story is often just as misunderstood. It gets treated like a reproductive problem, but the root cause? It's often metabolic. The ovaries are just downstream. They're just reacting to a deeper issue, high insulin levels caused by insulin resistance. Understanding that completely shifts the focus from just masking symptoms with birth control to fixing the underlying metabolic health.
So that leads us to our final section, taking back control. And that's the key, right? The good news here is that when you understand the root cause, whether it's inflammation or metabolic dysfunction, you get your power back. It shifts the entire narrative from feeling helpless to having agency over your own body.
So what can you do? It really boils down to these 4 foundational pillars. These are your health non-negotiables. Prioritizing sleep is when your body actually fights inflammation. Managing chronic stress stops that constant flood of glucose that fuels insulin resistance. An anti-inflammatory, fiber-rich diet feeds your good gut bacteria and calms your whole system down. And building muscle, that creates a huge metabolic engine to help you manage your blood sugar. These aren't just suggestions, they are absolutely crucial. So let's end with this. For centuries, the menstrual cycle has been framed as a weakness, an inconvenience, the curse. But what if we unlearn all of that? What if it's actually your body's most powerful built-in diagnostic tool? By learning to listen to your body, you can turn what was once seen as a liability into your greatest strength for a longer, healthier life.